I believe all of us are made for something better than we have achieved so far. And I believe each of us knows that in our heart of hearts. The first principle of medicine is primum non nocere. That's Latin for first, do no harm. The Hippocratic Oath, which many of my colleagues and I swore before becoming physicians, specifically says, I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect. Similarly, I will not give a woman an abortive remedy. The wisdom of this approach for more than 2 millennia has proven itself in the case of hormonal contraceptives. How many of you are daughters, or have daughters, or granddaughters? And how many of you have a mother who was a daughter? All of these daughters, even the embryonic daughters, have special inalienable rights. Some of these rights were discovered through a series of unfortunate events. The Nuremberg trials helped us to discover the importance of a right to informed consent. Informed consent is a right of the individual to know what is being offered, including its risks. This takes on special significance when what is being offered is elective, meaning that the person is free to take or not take what is offered. Responsibility for your own microenvironment is yours for the most part, but we all have a responsibility for our macroenvironment as well. In the case of medication given when there is no disease, the burden of proof of complete safety to the micro and macro environment is the responsibility of the prescriber to provide informed consent, since there is no harm in not taking it. The Food and Drug Administration has been careful to detail the common side effects of hormonal contraceptives, such as nausea, decreased libido or sex drive, abnormal bleeding, etc., as well as the less common, such as leg swelling, chest pain, loss of limb function, and of course, death. This does not make these risk-free medications, and yet surveys testing informed consent in the use of these products is terrifying. There is generally more cautions, verbal and written, to ride a roller coaster. According to the Physician's Desk reference of 2007, taking even the lowest dose pills have a 5 to 316 deaths per million incidence. That represents a microenvironmental risk of the first order. Death of the host organism is evidence of severely altered environmental conditions. The human pesticide experiment. Evidence of environmental risks have been more and more prolific and more concerning regarding hormonal contraceptives. How do oral contraceptives affect cervical cancer risk? Evidence shows that long-term use of oral contraceptives may be associated with an increased risk of cervical cancer, that is the lower part of the uterus, and researchers found a 4-fold increase in risk among women who had used hormonal contraceptives for longer than 5 years. Risks also increased among women who began using hormonal contraceptives before age 20. Dr. Chris Kallenborn, in Mayo Clinic Proceedings, has published a link between hormonal contraceptives in the developing breast and a 40% increase in early premenopausal breast cancer. In 1960, when the pill was approved by the Federal Food and Drug Administration of the United States was leading the world into space. Now, according to the National Cancer Institute, the United States is leading the world in breast cancer incidence. Do you suppose our healthcare budget would be lower if this cancer burden were lighter? For those that are intending to take the pill, it could be said that they knew the risks. And maybe they did. But what if this same carcinogen is in our drinking water? The oil spill in the Gulf of Mexico is certainly an unfortunate event, with long-term consequences for the humans and animals of that region. For exactly 50 years this month, women have been taking hormonal contraceptives on the advice of their healthcare providers, and their bodies have been dumping these second-hand steroids through their urine into the wastewater supply. Since these carcinogenic chemicals are not always tested for and are not filtered out of wastewater, their presence in the freshwater supply can and apparently does affect our macro environment. Dr. Conrad Voles of the University of Pittsburgh Cancer Institute has performed studies to demonstrate that estrogenic chemicals have feminized male fish, who are downstream from sewage treatment effluent to a greater extent than even industrial waste effluent. This study of salmon flesh demonstrated that preparations made from this flesh actually caused human breast cancer cells to proliferate. Already in 2002, Dr. Susan Jobling from Brunel University in England said that the research on fish in 10 rivers in her country should be taken as a warning to humans who have noticed an increase in male infertility and a steady decline in sperm counts over the last 50 years. A water quality assessment in carp from United States streams indicate that fish in some streams within all regions studied may be experiencing some degree of endocrine, read hormonal, disruption. According to the U.S. Fish and Wildlife Services, endocrine disruption has the potential to compromise proper development in organisms, leading to reproductive, behavioral, immune system, and neurological problems, as well as the development of cancer. Effects do not show up until later in life. Joe Carter in First Things indicates that hormonal contraceptives have been used as human pesticides in the hands of some. We have enough evidence now to raise the alarm that these chemicals are in our environment and are having devastating effects on it and us. Those that are taking hormonal contraceptives are not being told through informed consent, which is their right, and many prescribers are neglecting these rights. They also have neglected the availability of non-hormonal alternatives. I would put to you that this could represent a nationwide attack on our very environment. If we don't act now to curb this abuse of the environment, we can expect more U.S. funds for these pesticides, greater health care expenses for infertility and cancer, and increased human suffering, and the further degradation of our precious environment. Now, the alternative. The alternative to all of this intervention and intrusion into the most intimate recesses of our bodies and their meaning is an inexpensive natural remedy which promotes healthy communication and enhances the intrinsic value of each woman, all women, as well as the value of children and even the value of men. It has very positive effects on the environment, the nation, the community, and our families. In fact, it has the most radical beneficial effects imaginable. It improves bonding in marriage, makes even thoughts of divorce rare, and when we consider what these alternative, cooperative methods of family planning have really done for the couples that practice them, it is somewhat of a wonder that the majority of patients, as well as doctors, aren't knowledgeable in them. Green sex is a general term that has been used to describe the variety of cooperative, observational methods of responsible parenthood that respect the dignity of the individual woman and couple and the natural biorhythms of fertility that order our lives and invite us to truly and fully experience one another. Natural family planning, in all of its forms, will in the final analysis be the method everyone will wish they had used. In a book I truly love to read and read, there is a passage which reads, "I place before you life and death, a blessing and a curse. Choose life so that you and your descendants may live." Everyone can and everyone wants in their heart of hearts to choose the first choice. Thank you.